Hi guys, welcome back to my channel, Nurse Life Balance. Today we're going to be talking about what I'm personally doing to prepare for my preceptorship in the ICU, intensive care unit. You guys, level 4, woo! Final semester, level 4. That just means that I'm in my 4th semester out of 4, and I cannot wait to be done. I cannot wait to graduate. You have no idea. It's been a long journey, and I'm just so ready to get in the field and start my career and start saving money and start this next chapter of my adult life. So I am counting down the days. But until I graduate, I'm gonna be working with a preceptor in the intensive care unit for my final semester. So this video is going to cover the 5 main things that I'm personally doing to prepare for my preceptorship in the intensive care unit. So let's get this video going one step closer to graduation. Woo, woo, woo. So for my preceptorship, I have to complete 15 12-hour shifts, and I have to plan with my preceptor on which shifts I'm going to come to. So she sends me her schedule, and I basically see in my schedule which days work, and then I show up at the hospital and I work with her. And my professors basically said that your preceptor is your mirror. So that means whatever your preceptor does, you do. Obviously, we have a couple exceptions, like we're not allowed to accept or put in any orders or, do any like narcotic IV pushes, anything like that. But mainly everything else, if our preceptor does it, we go and do it with her. I'm lucky enough to be paired with an ICU nurse, and I'm so excited because that's the unit that I hope to work on once I graduate nursing school. So I'm really excited to get this experience and learn some new skills under critical care nursing and start my journey to become a critical care nurse. This will actually be my very first time doing clinicals in an intensive care unit, so I'm going to take extra time to prepare because during my other clinicals, we never had the chance to go work in an ICU. So I'm really taking these steps to make sure that I feel prepared and feel okay to start in the ICU. The first thing that I'm doing to prepare for my preceptorship in the ICU is making sure that I have all of my equipment and supplies ready and packed in my bag before I go. I'm gonna show you. Can you guess what's in the bag? I'm sure you healthcare workers probably know, but for my friends that are not in healthcare, surprise, here we go. Woo! An N95 mask. So through my school, we had to get fitted for our N95 mask. You have to be specially fitted for it to your face. So before you can even use one of these in the ICU or in any part of the hospital, you need to be fitted either from your hospital or your school as a student. So my school helped fit me for this, and I'm gonna be bringing one to the ICU. I'll show you guys how to put it on. It's really, it's something. These things are challenging, don't laugh. Okay. Oh, see, it's hard. Oh boy, I definitely look like a noob. I'm gonna be walking around the ICU like with my mask messed up. So I'll be bringing this. I hope that the hospital will have some extra, but with the shortages right now, you never really know. So it's good to come prepared if you have your own N95 mask that you were fitted with. And I got this through my university, so I'm gonna be bringing it. The next item I'm bringing is my face shield. I do have a couple different versions of these, but to work with patients that have certain conditions, you do need to protect yourself as a healthcare worker. So I'm gonna be bringing my very own face shield. This one, I do like this one. I also have glasses I'm gonna bring, just like for protecting myself as well from like bodily fluids, but these are also blue light blockers. See, it's blocking my ring light. That's how good it is. So I'm gonna bring those as well to give me a little bit of eye protection and just to make sure that bodily fluids don't fly into my face. The next item, would you even be a nursing student if you didn't have this? Of course, I'm gonna bring my little clipboard. This will help me with all my clinical documents that I'm gonna be carrying around, and it also has a cheat sheet on here for a bunch of different lab values and conversions and just all types of little reminders for us. What's next? Okay, of course, pen light. I see you in the ICU. I'm funny. Get it? I'm gonna see you. Come on, you guys know I'm funny. Thanks. Anyways, gonna bring my pen light. This is really good for, doing a head-to-toe assessment if you need to check the patient's pupils, as well as looking in any orifices. Next item, of course, stethoscope. Fun fact, do you guys know how to properly put in a stethoscope? So the way, you see how it kind of sticks out like this? That's how you face it away from yourself. And then you put it in. So yeah, I learned that before nursing school because my mom is also a nurse, and she taught me that you want the earbuds to be pointing away from you, and that's how you put it in. A lot of people might think that you put it in this way, the way facing towards you, but that is inaccurate, and you want it to be facing away. The second thing I'm doing to prepare for my preceptorship is reviewing important topics that I learned during my critical care semester. I'm just choosing the topics that I think are important. I could be completely wrong, but I do think that these are going to be things that I see in the intensive care unit. And the first one is SIRS criteria. SIRS criteria is important to know, in my opinion, because you're going to be working with patients that might have suspected infections, and you also want to help prevent your patients from getting infections. So this is an important criteria to be on the lookout for as you're working with critical care patients. Another topic is VAP bundle, ventilator-associated pneumonia prevention. And this is an important thing to consider if you have patients that are intubated, and a way to help prevent them from getting ventilator-associated pneumonia, which is actually a common disease that patients long-term in the hospital get. So it's a way for us as nurses and nursing students to make sure our patients do not get ventilator-associated pneumonia. The last main topic that I'm going to be covering are the different types of shock. And as you can see, they're all similar in the sense that they will have hypovolemia and tachycardia, except neurogenic shock. That will have bradycardia. The third thing I'm doing to prepare is reviewing the steps of a code blue. I also want to review the roles of a rapid response team, because it is common for ICU nurses to be pulled to be part of a rapid response team and have to go all over the hospital if a rapid response is called. So I'm gonna try and review that. I also want to familiarize myself with the items of a crash cart, because that's important if you have critical patients. If any of them are crashing, you wanna know what's in there. So I think that can be important as well. So I'm just gonna kind of review the basics of what to do when a patient is crashing and how the logistics work for a code blue and a rapid response team. I'm sure there's a lot more topics that I should review as well, but these are the ones I'm gonna start with. And as I get further along in my preceptorship, I'm going to keep reviewing and keep learning. That's the whole point of preceptorship, is to learn and to improve your skills as a nurse, as a incoming nurse. The fourth thing that I'm doing to prepare is honestly more of a personal thing. It's more so to mentally prepare myself for the difficult conversations that are going to be coming, because if I'm being real, I do think that the intensive care unit is a really sad place at times, and you're going to be working with patients at some of the worst times of their lives, and you also need to communicate with family members about the patient, and it's really tough. So I just want to mentally prepare and, get ready to have those difficult conversations with patients and their family members. The ICU can be very tough mentally to work in, and I just want to make sure that I'm in the right headspace before I go to the ICU, and really just, remind myself that I'm here for the patients and I'm here to help their family members through this hard time as well. And number 5, the fifth thing that I'm doing to prepare for my preceptorship is making sure I get a good night's sleep before I go to the hospital, and making sure that I pack my lunch ahead of time. So that I'm not scrambling in the morning, because those days are early, man. Like, I'm gonna have to be up at 5 a.m. at the latest. And if you make sure you prepare your stuff ahead of time, it really just makes your morning easier, and it makes you feel like you're not rushing. So those are the 5 things that I'm personally doing to prepare for my preceptorship in the ICU. If you guys have any advice for me, if any of you guys have gone through a preceptorship in the ICU, or if any of you have started as a new grad nurse in the ICU, Please drop your comments down below because I would love to hear your advice. This is a very new chapter for me, and as excited as I am, I'm also a bit nervous. I want to make sure that I maximize my experience there. So if you guys have any comments or tips, let me know below. I would really appreciate it. If you guys want to follow for more content, you can subscribe and follow along for weekly videos about all things nurse-life balance, all things health and wealth. Well, hopefully one day. All things health and balancing your life with work and making sure that you maximize your time to live the best life you can, because life is short and we gotta live it to the best we can. So follow along. I'll see you guys next week on Nurse Life Balance. Mwah! Can I be real with you guys on a real note? Like, nursing school is hard. Not even that the content's like terribly hard. I mean, it is challenging, don't get me wrong, but in my opinion, in my experience, the hardest part is your exhaustion levels. Like, this is exhausting. You're constantly doing something, and if you're not doing something for school, if you have a job, you're working, and it's just tiring. And I know me and a bunch of my classmates are feeling it. Like, we're on the home stretch and we're just ready to be done. You know, I'm gonna make the most of this final semester preceptorship experience, and I am really excited for it. Don't get me wrong, that's definitely the highlight of my semester, but I'm tired. It's tiring, but you know, I know it'll be worth it, and I'm just trying to truck along until I finish and then get started as a new grad. But yeah, I just want to give a shout out to all my other nursing students and all my other healthcare professional students. Like, this is not easy. So you guys are doing it. Like, we gotta give ourselves some credit. So congratulations to all of you, and congratulations to myself, because this is not easy, but we're doing it. That's what matters. We're doing it, and we're gonna do it. And that's what is gonna matter in the end. So just stay true and, you know, stay pushing along. And don't forget to take time for yourself, because you need those breaks. This is not easy. So make it easier for yourself by taking little breaks here and there and do things you enjoy. That's what we're all about here on Nurse Life Balance.